Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. According to new analysis, people with intellectual disabilities and developmental disorders are 3 times more likely to die if they have COVID-19. Group homes have reported 477 COVID-19 deaths as of November 4th. And with services being cut, the often forgotten most vulnerable continue to face the highest risk during this pandemic. On December 9th, the New York City Developmental Disabilities Council and families are holding a virtual rally to advocate for the safety and survival of people with disabilities during the pandemic. Joining us now to discuss are Joanne F. Siegel, president of the Bronx Developmental Disabilities Council, and Lucy Reyes. Lucy is a Bronx Parent. Welcome. Thank you both for joining us today.
Thank you.
Thank you for having us.
Of course. So first to start, Joanne, can you please tell us more about the Bronx Developmental Disabilities Council and the work you do there?
Sure. The Bronx DD Council is an association of parents, advocates, consumers, and some professionals concerned with the needs of people with intellectual and developmental disabilities. Intellectual disabilities refers to people who may have autism, cerebral palsy, epilepsy, and any type of neurological or learning problem, and usually occurs before the age of 22. We're one of 5 councils. New York City has a council in each borough, and we were actually mandated in the 1970s to help the city plan for services for individuals and their families that have IDD, and we contribute to an annual service plan and that talks about their concerns and the needs of the population. We meet monthly, and we have a lot of committees that also meet monthly to provide education services to the community. We have a health conference, a housing conference, and a family support conference, as well as meeting with legislators over the issues and concerns that we have.
Thank you. Thank you for sharing, Joanne. And as we know, families in the Bronx with disabled loved ones have faced numerous challenges prior to COVID-19. How has this pandemic exacerbated these challenges?
Okay, it's a complicated question because we go from birth through we go into adulthood through OPWDD. So we span the lifespan. So I thought if I talk a little bit about stages of life and the services that come with it. We have, when a child is born and there's some question about their development, many families go to their pediatrician, and the pediatrician refers them for what's called early intervention services. And that service category covers children from birth to 3 years of age. And it includes an extensive evaluation and then services that the child might need, like speech and language services, physical therapy, occupational therapy, and it's actually a large group of children that are served by that program, because it also includes children that might have some health problems and health issues at birth. But even before COVID, Medicaid had, it's a Medicaid-funded program. Medicaid had been reducing its coverage for these programs, and so there were wait lists, and unfortunately, I've worked with some families, and they had to wait even 6 months before a child could get any services or be interviewed for the first evaluation, and that's a long period of time in a child's development. After COVID, what we're seeing is that the evaluations are not being able to be completed. Many staff people are not willing to go into homes because that's where it's a home-based service. And so either they can't get into the home, or the family really doesn't want them at this point with the risk of getting COVID. They don't want the individual in. So it's really affected a lot of these young children. And this is a real problem that we're facing now. When a child reaches the age of 5, from 3 to 5, they go into preschool programs and then school age programs. And over the years, there are some programs that are part of our council. They're called 4410 schools and 853 schools. And therefore, children who would not get into public school because there was no placement, their disability is so severe that they need to, the Department of Education needs to contract with a nonprofit organization to do the services. Well, even before COVID, there were problems with maintaining staff because, again, the funding for these programs was less than what the Department of Education would normally pay a teacher. So we would lose very good qualified teachers to the Department of Education. Since COVID, and we had long waiting lists for these programs, okay? But since COVID, and people are afraid to have their children go out of the home, enrollment is now operating at about a 20% capacity. And they're either offering some remote learning for children, which really doesn't work for very young children, and certainly not for children who are autistic, okay? And so they're at 20% capacity, which means that they're not, but they still have these buildings, and they still might have staff that they want to keep on, and they're not getting the income that they should be getting. So they're in great jeopardy of closure. And this is a theme for all of the services. We have kids that then transition out of the school, the Department of Education, and they go into a system called New York State Office for People with Developmental Disabilities. And that department is funded, most of the services, through Medicaid, and a lot of other federal monies. And we've been having problems over the years, again, because of cuts in Medicaid with financing these programs for adults. They include residences, they include day programs. Now, when COVID emerged, the real problem has been, number one, day programs could not remain open. And very few individuals are actually going to them even now, because of the high risk of COVID. So they closed many programs, at least temporarily, but the fear is that they will not open. That is a fear that people have. The other problem is in residential care. People who are living in group homes or like apartment living type of situations. Again, the funding has been cut prior to COVID for many of these services. And so they were teetering on having problems sustaining themselves. But with COVID, what's happened is the state has not filled any of the openings because of financial reasons and concerns that they don't have enough money to cover. I just want to give you a statistic in terms of what's happening. In New York State, there's 140,000 children and adults in the OPWDD system. Because of COVID, 477 individuals have passed away because of COVID. And 90% of those individuals were living in group homes or congregate care settings. They had and this was as of November 4th of this year, they had about 3,906 confirmed cases of COVID, and staff, they had 4,911 staff members. So COVID is very rampant within the population. It's a very, very serious. A lot of people have medical conditions, and so it exacerbates the situation. The agencies have not been gotten funding to buy protective PPE, protective equipment, and they have not really gotten overtime. They've not been reimbursed for overtime, hazard pay, and it's just very, very serious problem.
And we're losing a lot of the DSPs, the direct support professionals that take care of our individuals. I know I'm sorry, Joanne, if I may. Even I can use my particular son's group home as an example. We have DSPs that are working 80 hours a week. And the state is not even facilitating to the agencies money for coverage. If you're not facilitating, who is going to take care of our children? Who's going to be with them? So we're losing DSPs left and right.
Those are some really staggering numbers, and thank you for sharing, Joanne. And I'm glad we have Lucy Reyes. She's a Bronx parent, and she's going to be able to share how the pandemic has really impacted her and her son's situation. Lucy, can you just elaborate a little bit more about the impact of the pandemic and why this upcoming rally is so important for you and the families of the Bronx especially?
Of course. This rally is essential. For so many years, even before the pandemic, our individuals, our families, have not been present in regards to the state. What am I trying to say to that? Before the pandemic, we were struggling, trying to get the services in place, clinical, therapeutic, the right school placement. Before the pandemic. Now, in many cases, there is nothing open. Our guys are staring at the same four walls. I am so scared as a parent of a 26-year-old, dual diagnosis of autism and impulsive disorder. What is going to happen to my child? I'm a single parent. It was hard enough to get him placed. It took me 8 years to get him placed at the residence he's residing in. And now, what's going on during this pandemic, I don't know if these agencies will even be open to continue serving our individuals. What am I supposed to do when so many parents like me? What's going to happen to our children, to our individuals? As Joanne mentioned, our individuals run from the age of 3 all the way to 90. We have individuals that live in these group homes that are actually 90, that we lost a lot of them. That's why Joanne was mentioning that there's beds potentially available, but the state will not provide money to place the individuals that have been on a waiting list for years. I myself, my son, was on a waiting list for 8 years before the pandemic, before he was placed. Now he's not even receiving speech therapy, occupational therapy, physical therapy, behavior therapy, and he's regressing. My son has gotten to a point he's having outbursts like he did when he was 3. His communication skills lack now. Everything that was accomplished by the team that have worked with him throughout the years, on a matter of months.
Wow.
Now to even think about that, he might not even reopen because there is no funding. I'm terrorized. I'm thinking we might go back to Willowbrook. No one wants to go back to those years.
And Lucy is just one voice out of so many families that are suffering through these times and advocating for this important legislation to be passed for families and individuals with disabilities. Unfortunately, ladies, we have run out of time, but I do want to invite our viewers to come and attend the rally and help you get this message out and, speak to the legislators. So please let us know where they can go, when it's taking place, what time, and how they can learn more about it at this time.
Okay, so it's the theme is Save Our Services. If anyone is interested in attending, I would suggest that they go to our website, www.bronxddcouncil.org, and we will be having information posted with the link, the Zoom link for this event. It will be done remotely, totally remote. So you can join us from your home. It will be on December 9th at 11 a.m. and last until 12:30. We're hoping to get our legislators there. Our goal is to ask our legislators, ask Governor Cuomo to be our hero. Go to Washington, get federal legislators to listen to us and get more dollars to the states. We need this money desperately.
Don't forget about us. Don't forget about our children. It's not fair because they cannot vocalize what they're going through, being left behind. Please support us.
Thank you so much, Joanne F. Siegel, the president of Bronx Developmental Disabilities Council, and Lucy Reyes. She is a Bronx parent. Thank you both so much for your time today.
Thank you.
Thank you.
Again, folks, that information for the Save Our Services rally will be taking place on Wednesday, December 9th at 11 a.m. You can visit bronxddcouncil.org for more information on the rally. The New York City Developmental Disabilities Councils invites you to join them and share your story by emailing photos of your family, posters, and more to info@nycfair.org. We'll be right back.